Okay, so good day, BSN1G. We are the group 6 and we will be discussing the skeletal system. Mind you that our report was just taken in Google Meet, and we are sorry that our camera is not working at as of the moment. And for this one, we will be discussing the skeletal system in passive, as this was already being discussed. So we will just going to give some of the details that we have been in learn. Okay, so the skeletal system is composed of the bones, cartilage, joints, and the ligaments. The bone is a hard structure that forms the skeleton that offers supports to the protecting organs, as also displays the pivotal role in the skeletal system. The cartilage is a flexible tissue that cushions the joints, that supports the structures such as the nose and the ears. The joints were the points where two or more bones meet, allowing for the movement, and the ligaments, which describes as the strong band of the connective tissue that links bones to the other bones. Okay. Next is the functions of the skeletal system. As for the word itself, the support and protection, this provides us a hard framework, okay, that surrounds the organs such as the brain and the spinal cord, together with your internal organs to stay intact and also para hindi pakalat-kalat sa body natin. For the movement, as the muscle is being connected to the bone, this allows for the movement of the body, and then the blood cell formation, okay, as being also discussed, the bone marrow, which is the red bone marrow, and then the yellow bone marrow. For the bones, this provides for the blood cell formation. Okay, so the bone markings is also not in smooth, but it shows that the bone markings which reveal the muscle, the tendons, the ligaments, together with the nerves and blood pass. Okay, so in the bone markings, it has the projection or processes and the depression and the cavities. For the projection and processes, these are the raised or nakataas, tawag doon, naka-indent na areas from which the muscles, tendons, or ligaments are attached. While in the depression or cavities, these are the indentation from the word itself, nakalubog, and it is the opening that allows the nerves and blood vessels to pass through it. Okay, so for the structure of the bone, we have the compact and then the porous, the spongy bone. Okay, so the compact, as from the word itself, it is compact, magkaadikit. So the outer layer of the bone was very hard and dense, while the porous is located in the ends of the bone or the long bone. Okay. Also, the compact bone is very hard, while the porous, from the word itself, it has a texture or it has like a structure that is a spongy type of bone. So let us now proceed in the changes of the human skeleton. In embryo, the skeleton is primarily hyaline cartilage. During the development, much of this cartilage is replaced by a bone. Okay, remember that. The cartilage remain in isolated areas, the bridge of the nose, parts of the ribs, together with the joints. Okay, so for the bone growth, the new cartilage is continuously formed. The older cartilage become ossified, nawawala. So the cartilage is broken down, and the bones replace the cartilage. The bones is remodeled rather, and lengthened until the growth stops. Okay, until it reaches its maximum limit. While the bone change shape by gravity and muscle pull, and then the bone grow in width through the periosteum. Okay, so we will be now discussing the osteocytes, osteoblasts, and then the osteoclast. The osteocytes is the mature bone cells. Okay, the osteoblast is the bone forming cell, and the osteoclast is the bone destroying cell. Okay, mind you, if I'm not that mistaken, this was being mentioned in the nervous system already. Okay, and then also in the skeletal system, this was also being mentioned by our ma'am Kate. So I will be not discussing this further. And then the next one, we also have the fractures. Okay, remember the two types of fractures, which is the closed and the open fracture. For the closed fracture, the damaged bone or the break bones, it is happening on the inside while the skin is being intact. or hindi pa lumalabas yung buto outside sa skin. While in the open fracture or the compound, as being shown by Ma'am Caitlin during the discussion, the skin is open already or lumabas yung buto outside the skin. So in the fracture reduction, we have the closed and the open. So in the closed, there's no surgeries needed. While in the open reduction, kailangan ng sementohin yung buto or lagyan ng bakal para magamit pa natin yung damaged bone or yung broken bone. Okay, during this, in the skeletal system, we also have the axial division and then the appendicular division. Okay, so in the axial, we have the skull together with the ribs and the vertebral column. While in the appendicular, we have the humerus or in the arm together with your clavicle, or rather, sorry, and up to your femur. Okay. So in your axial division, we have the skull and the auditory ossicles, which is located in your ear. The hyoid together with the vertebral column and then thoracic cage, which consists of your ribs. Okay, so that's the hyoid bone. And then together with your ribs, okay? While in your appendicular division, we have the pectoral girdle and then the pelvic girdle. Okay, remember that. Okay, so for your actual skeleton, we have the skull and then the associal bones, sorry. The auditory ossicles, which is located in your ear, and then your hyoid bones, together with the vertebral column, that's just a typographical error, and then your thoracic cage, together with your ribs and the sternum. Okay, so that is your skull, together with the hyoid bone, and then the auditory ossicles. Okay. Okay, so let us now proceed on the sutures. The sutures is the immovable joint that join the skull bones together. So this, what do you call this one? The sutures is plays pivotal role as this serves as the markings and the remnants from which you will be able to identify, okay, the different parts of the skull. And it also allows the growth of the brain and the skull of the infant's first year. Okay, remember that? And then together we have the adult skull. So the skull has or consists of 22 bones, the cranium, the 8 bones, and then the facial bone for 14. It consists of the nasal, the maxillae, the zygomatic, the mandible, the lacrimal. Somehow we are familiar for the positioning of the facial bones as this was being in the rotating or this was being included in the rotating exam, and we have given the time to memorize it. Okay, together with the cranial bones, it consists or attached to a membrane called the meninges. It was also being discussed by our group, which is the nervous system. The outer surface provides large areas for muscle attachment that moves the head or provides the facial expressions. Okay, so let us now proceed on the paranasal sinuses. The sinuses is the part of the nasal complex, together paired in the ethmoid, sphenoid, frontal, and the maxillary. Okay, so this is kind of familiar for us as well, as this was being included together with our return demonstration. So it is important, especially the sinuses, as we will be able to distinguish each part. So remember the frontal, the sphenoid, together with the ethmoid, and then the maxillary sinuses.
So we're going to discuss next the adult vertebral column. It has 26 vertebral cervical. It contains of 24 individual vertebrae, the sacrum, and then the thoracic. It has 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, lumbar, sacrum, and coccyx. They are fused together. Next is the typical vertebrae, the T1 to T12, all articulate with ribs. It has heart-shaped bodies. Each side of the body bears the femacets for articulation with ribs. Next is the typical cervical birth, the C3 to C7. It has smaller bodies, larger spinal canal. The first and the second cervical vertebrae are unique, which is the atlas and the axis, which is located in our neck. Next is the thoracic vertebrae. It allows us to rotate and prevents flexion and extension. Next is the sacrum, the S1 to S5. It forms the posterior walls of the pelvis, formed by 5 fused vertebrae. Superior surface articulates with L, inferiorly articulate with coccyx. Coccyx, also known the tailbone, formed from 3 to 5 fused vertebrae, offers only slight support to pelvic organs. Next, we're going to discuss the appendicular skeleton. First is the shoulder pectoral girdle. It contains the clavicle. We have two clavicle. The thin bones positioned horizontally in the shoulder region articulate with scapula on the sides and the sternum. Next is the scapula. We have two scapula. It is the flat triangular bones that can easily be felt on both sides of our back. The wide bones support several muscles in the shoulder joint. The scapula articulates with the clavicle and the humerus, the upper arm bone. Next is the ulna. We have two ulna, longer than the radius. It is located on the side of our little fingers. The radius and the ulna connected the elbow to the wrist, allowing us to rotate the forearm and wrist. Next is the carpals. We have 16 carpals, the 8 irregular bones lying on the wrist in each hand. These bones articulate with each other as well as the radius, ulna, and the metacarpals. Next is the metacarpals. We have 10 metacarpals, the 5 long bones in each hand, forming the distal parts of the palm. These articulate with the lowermost row of the phalanges. Next is the phalanges. We have 28 phalanges, the 14 bones that form the fingers. Each finger has 3 phalanges, except the thumb, which only has 2. Next is the pubic girdle. It contains a hip bone. It is one large bone formed of 3 irregular bones that fuse during puberty and early adulthood. The 3 irregular bones is the ilium, ischium, and the pubis. Pelvic girdle. The pelvic girdle is responsible for bearing the body's weight, allowing us to stand or sit straight and walk. Next is the leg bones, the lower limb bones. First is the femur. We have two femur, the heaviest, longest, and strongest bones in the human body. The femur is the only bone in the upper leg or thigh region. Next is tibia. We have two tibia, the bigger and only weight-bearing bone in the lower leg. It articulates with the femur on the end and the tarsal bones on the other, thus connecting the foot to the upper leg. Next is the fibula. We have two fibula, the smaller of the two lower leg bones. It is attachment point for multiple leg muscles. The fibula articulates with the tibia at the both its proximal and distal ends. Next is the patella. We have two patella, also known as the kneecap. It is the biggest sesamoid bone in the body, forming the knee. Next is the tarsals. We have 14 tarsals. Similar to the carpals, the tarsal are the small irregular bones forming the heels and part of the arc. Next is the metatarsals. We have 10 metatarsals. These are the bones corresponding to the metacarpals in the hand, and like them, they are articulate with the toe bones, forming the distal part of the foot arc. Next is the phalanges. We have 28 phalanges, often referred to as the phalanges of the foot. These are the bones forming the toes. Each toe has 3 phalanges except the big toe, which only has 2. And that would be all. Thank you for listening.